Well, hi, I'm Dr. Valerie Black and I'm the Clinical Director of the CAF service, and I've worked in the inpatients and outpatients and been working there for quite a long time.
Hi, my name is Shelley and I'm a parent of neurodiverse kids, and I am also neurodiverse, and I'm here today to ask some questions about the process of accessing CAF. The first question I wanted to ask is, my husband and I have been to the GP and we now have a referral to CAF. What's the process next? Like, how long will it be before we're notified, and how will we be notified by CAF?
So when a referral comes in, it comes to a group we call CAF Link, and they triage all the referrals. So you might find that they ring you to get further information to help them make a decision about the referral. And then if they accept the referral, then your GP will be notified within a day or so, and then the referral is passed on to the team that will treat the young person, and so you'll then get a letter within a couple of weeks letting you know that your child is on the waiting list and how to access a number of supports.
So if I haven't received a letter, how long should I wait, and then who should I contact?
I'd wait a couple of weeks and then I'll contact CAF Access.
From when the first referral's been made?
Yeah.
Excellent. Can you decline my GP referral?
Yes, yes we can, and sadly we have to decline a lot of people that are referred because otherwise we'd have a wait list of 5 years. So we do have to do that, and we always try and think quite carefully about what services in the community would be relevant for that young person. So we'll always give the GP a list of recommendations of other services that they could potentially go to. So it would be always worth, if you haven't heard anything, checking in with the GP if the referral has been declined, what CAF recommended.
And if I felt that it should have been accepted, can I ignore that recommendation and just ask him to re-refer?
You could do that, but probably if nothing had significantly changed, the CAF service would say, please ask them to do these recommendations.
If we do the recommendations and nothing improves, can we ask to be re-referred
be
at that
referred
point?
back, yes. So most of the young people who are accepted by CAF have done some work in the community before they are accepted.
Once we have made it on the wait list and we have a letter,
Yeah.
how long?
Well, that's a really difficult question to answer because there is quite a significant wait list, which is really quite distressing for us that we have that big wait list, because unfortunately every week way more people get referred than we can see. So it kind of depends. If it is like, for example, ADHD and there aren't major risk factors, you can wait quite a long time, up to say around 8 months or so. And if it's more urgent, more significant risk factors, then we triage them as we go.
If I can access private mental health for
Yes.
my child, because I
Yes.
know that service is also extremely stretched, and I'm on the wait list,
Yeah.
will I be thrown off the wait list, or can I just wait until we get to the front of the wait list and then just go public from there?
Obviously, if you can access private mental health support, then that's fantastic, because obviously it is really stressful for people sitting on the wait list. When your appointment comes up, obviously disclose that information, and then there can be a discussion. I mean, if the private help has been really helpful, you might decide that you don't actually want to come to CAF, and you might decide to decline that appointment, or it may be that actually then you want to transfer over to CAF. And we're very mindful that private mental health care is very expensive, and it's a huge financial stretch for many families, and they might be able to afford it for a short period of time, but not for the amount and course of treatment that's required.
That's reassuring. Is the phone call at the start
Yes.
part of that triaging?
Yes. So the phone call at the start, not everybody gets a phone call, because sometimes at the very start, because sometimes the referral is very clear and it's very obvious it needs to be accepted and it will go through. If there's concern about risk issues that have been identified, or if there's any things that the team that are making the decisions about accepting or declining feel they need to ask more about to make a good decision, then they'll ring and talk to the family.